Protocol number 16, nervous system. So what we want to do is we want to balance the nervous system. And so what we're going to do with Sam is we're going to come to 4 different points in order to balance the parasympathetic nervous system and the sympathetic nervous system. As you're probably aware, the parasympathetic nervous system is for regeneration, restoring, helping the body to regenerate, where the sympathetic nervous system is more for fight or flight. So what we want to do is we want to make sure that we have a good balance between the parasympathetic and the sympathetic nervous system. So we're going to do some points. So I'm going to ask Stan to stand up for me, and we're going to actually turn him around here for the first point, and we're going to have him put the glasses on, and we're going to start here at the brain stem. So the brain stem, we have an upper brain stem and a lower brain stem. The upper brain stem is the beginning of the parasympathetic nervous system. So I'm going to start by lasering with infrared. Hold on one second. Wants to play here. So we're going to come to the brain stem, which is right underneath the occiput here. All right? We're going to do 30 seconds of infrared to start with. So the brain stem is the beginning of the parasympathetic nervous system. It's the higher point. Our next point was going to be the vagus nerve, and I'm going to show you how to do that as well. So 30 seconds of infrared, and then we're going to switch to 40 seconds of red. Now, Sam, can you feel anything?
Just a little warmth.
Just a little warmth. So he feels a little warmth, so I'm going to back it away. So thanks for letting us know. So I back it away just to make sure that we don't get the skin heated up too much. In areas of inflammation, as we talked about before, it might get warm a little bit faster than it usually dissipates. So we're going to do a good job to communicate with the patient so that we make sure that we have a really good treatment. Now, the next place that I'm going to go after the brainstem is that I'm going to switch it back to infrared, and I'm going to come underneath his chin. But because he has that bad hip, I'm not going to turn him around, okay? But I am going to come underneath the chin right here. This is the point that I like to laser for the vagus nerve. The vagus nerve is the biggest parasympathetic nerve. It controls breathing, it controls heart rate, it controls digestion. It's really, really important to reset this vagus nerve because it is so vital in controlling so many different things. Now the vagus nerve works in conjunction with the heart to slow the heart rate down. So we definitely want to have the vagus nerve working well. So I'm switching now to red underneath the chin, 30 seconds, infrared, 40 seconds of red. Now, the job of the vagus nerve is to inhibit the sympathetic nervous system, which comes from T1 to T12, right? This is the sympathetic chain. It controls the controlling of blood supply, right? The diameters of blood vessels. So we need to have good unison between the parasympathetic and the sympathetic, and we call this the automatic or autonomic nervous system. So from that point, we're going to go to T1. So T1 right here, the top of the sympathetic chain, we want to make sure that we inhibit that so we don't have too much sympathetic tone or fight or flight. We're in the healing aspect. We want them to come back into parasympathetic tone, and so this is a really, really protocol for so many different applications, so many different patients that have things going on. Definitely look for this with people that have high blood pressure, people that have, again, heavy breathing maybe too fast. We need to get them back into a nice normal breathing pattern. So from infrared to 40 seconds of red, okay? Now, you feel anything here, Sam?
No, let's go.
All right, comfortable. So after we do this, we're going to come down to T12. T12 is going to be our last point. When we do some of the more advanced work, we'll show you how to reset the cranial nerve 10 and some of the other cranial nerves that are involved in the parasympathetic nervous system. Because it is a big one for us. Okay, come on. There we go. So now we're come on to T12 here. So T12 to T1, sympathetic, parasympathetic is cranial and sacral. So those are the big places that we really want to be. So we're going to do this just for time's sake. I'm going to switch this up because we're just about done for about another 40 seconds. We know people that have cervical and lumbar pain have twice the risk of heart attack and stroke to non-pain patients, okay? So the cervical and the lumbar or sacral area decrease the frequency of firing into the sympathetic to allow it to cause a higher sympathetic tone. So I was a little bit unclear, or maybe not clear enough. So when we come and we look at this autonomic nervous system, it's really important for us to make sure that we have this in balance, because people that have cervical and lumbar have decreased parasympathetic tone, allowing for more sympathetic tone and greater chance of heart attack and stroke. All right, that's going to finish this one up. Thank you.